I'm Zeno Perini, I'm a neurosurgeon, and I work in a cyberknife center in Vicenza, where we treat, in particular, pathology of the central nervous system, in particular encephalic pathologies, but also spine pathologies. And we treat pathologies are benign and malign tumors, and AVMs, in particular for the vascular AVMs, and also cavernous malformation or angioma cavernosus. But we don't treat, of course, the aneurysmal pathologies. And our experience is of 22 years, because the first cyberknife in Vicenza started work in the February of 2003. In fact, we have celebrated the 20 years of cyberknife in Vicenza in May of 2023. And we are proud of our organization and of our job, but we can improve it, I think. So I present here in ISRS of Geneva. I present a poster about the treatment of the glomus tumors. We have treated from the February of 2003 to the December of 2023. We treat 51 glomus tumors, and with cyberknife, and in particular, several cases of them we treat after previous embolization. We use, especially in this case for glomus tumors, we use a nice dose between 75–80%. So, and the maximum dose we used is potentially 22.5 grays of max dose. So a nice dose of 80% is 18 gray, and we perform often we perform 3 fractions to spare the organ at risk. And we have good results in the treatment. We have, with the first treatment, we have 74% of success in the control of the pathology, and 15–16% of reduction of pathologies. 6 cases has an increase of the volume of the lesion, but 5 of them we have performed with success another treatment and now are in control. One of them have a problem because the glomus tumors increased and he was operated on. These are statistics that we have on 43 patients of the 51, because the follow-up was difficult. In fact, 8 patients, 1 patient was passed away for senectus, and the other 7 don't came to the follow-up that we perform. So 43 patients in the follow-up, and we have a follow-up from over 60 months of follow-up, and the follow-up, longer follow-up, is 216 months, if I remember correct. And yes, we have good results because we have very good control of pathology. If we consider the control of pathology and the regression of the dimension of the pathology. And I think it's a valid tool to the treatment and for control of this kind of pathologies, and despite surgery, because surgery often is invasive, is very invasive for this kind of tumor, and could leave some neurological deficits that are very important for the patient that have this kind of deficit, like dysphonia. Like it's very difficult to eat, for example. It's very difficult to speak because it's not a quiet dysphonia. In certain cases we have aphonia in these patients, and we have a problem with the function of the 8th nerve with a loss of listening. And I can affirm that this kind of methodic to the treatment for the glomus tumors is a very useful tool, and probably is more efficacy than the surgery, the normal surgery.